When a person has metabolic syndrome, it means there are several reasons why they are more at risk for heart disease and diabetes. The number one reason is usually that they carry extra weight in their midsection.
There are two basic body types that most people have. The first one is an apple shape, where we store most of our weight or most of our excess fat around our midsection. So some people might call it the spare tire kind of effect. The other shape is the pear shape, where we store most of our fat or most of our weight around our hips. When we're comparing the two body shapes, the apple shape is really the one that puts us at risk of more disease. The reason why that is because we're storing excess fat around our midsection, where all our vital organs are. So we start to get an increase of our fatty acid buildup, which is starting to impair some of the function of our organs, such as our kidney and our liver. So we're getting decreased metabolic reactions happening. It's putting us at increased risk of things like diabetes, high blood pressure, cardiovascular disease. So if we have that sort of predisposition to that shape, we really need to make sure that we're monitoring it and trying to keep at a healthy weight.
Men are considered at risk for metabolic syndrome if their waist circumference is greater than 102 centimeters. Women are considered at risk if their waist measurement is greater than 88 centimeters. But metabolic syndrome is more than just excessive weight around your middle. Metabolic syndrome is a combination of medical disorders that increase the risk of developing cardiovascular disease and diabetes. People with metabolic syndrome often have high blood glucose levels called hyperglycemia, high blood pressure called hypertension, low levels of good cholesterol called HDL, and high levels of fat in their blood. Having metabolic syndrome doesn't mean it's too late to change. If you eat a healthy diet and get regular exercise, you could lose weight and raise your good HDL cholesterol. These lifestyle changes would greatly lower your risk of developing heart disease. By losing weight, your blood glucose levels could improve. That means you would be lowering your risk of developing type 2 diabetes. 1 in 4 Canadians is believed to have metabolic syndrome, and that rate is even higher around people of First Nations and South Asian descent. Make an appointment to talk to your doctor about your risk factors.